Welcome to Boss Up Academy, where you can get your stimulus updates as well as your business investing and your real estate investing as well. And we have a special guest on with us tonight. I'm so excited to have Nathan here with me tonight, and he's going to tell us about the healthcare marketplace. We're going to go over that in detail. I did advertise this for business owners, but I also went back and made another post that says that anybody that is in need of health care, it's not just business owners that could use this information. So if you know anyone that may not have insurance or are in need of insurance, please do like, share, tag them in this video. This time, instead of saving a business, you could actually be saving somebody's life if they're able to get adequate health care in order for them to survive and to live or get prescriptions, medicines that they may need. So we are very excited, and we're going to get started in just a minute. Well, our format tonight is a little bit different. I'm streaming live. I'm actually videoing my computer screen on IG so that the people that are looking on IG, they can actually see it from my computer screen so they can see both of us. And so we're going to get started. So Nathan, if I've got your number on the screen in case somebody needs to contact you, but can you tell us who you are and what exactly you do?
Sure, absolutely, Erica. Thank you again for having me. It's a pleasure to have the opportunity to tell everybody a little bit more about getting healthcare coverage. My name is Nathan Santalucia. I am the owner and agent for MediCarolina's Health Insurance and Medicare Solutions Agency. I'm based in Fort Mill, South Carolina, licensed in North Carolina and South Carolina. As you see, my telephone number, 704-773-3033. I am licensed for health insurance, life insurance, Medicare plans, disability coverage, dental, vision, hearing. Truly, as it comes to the needs of health and sustainability, that's what I do. I don't make a lot of the health insurance products you can buy, but I'll make a lot of the health insurance products you can buy better.
Okay. So we're going to start off, and because it's open enrollment, and tell us what's the window for open enrollment, just so that people can know the urgency that if they need to take advantage of this, that they got to get on it.
Certainly. So every year, the open enrollment season for health insurance that's done through healthcare.gov is from November 1st through December 15th. That's when you can apply for a tax credit and search the plans that are available based on your location. Again, that window from November 1st to December 15th to select a plan that can start on January 1st. This upcoming year, there is an expanded window as well. If you do happen to miss that December 15th deadline, there is an opportunity to look for coverage between December 16th and January 15th for a plan that could start on February 1st. But as this is a typical window, every year, that is about the month and a half that you would have to take a look at what's on the marketplace. And enter in information, update your location, your address, and the members of your household that may need coverage as well.
Okay, so what is the health insurance marketplace exactly?
Sure. The health insurance marketplace, it was created when the Affordable Care Act was passed, and it was launched in 2013. It started, it's a website, it's healthcare.gov. It's colloquially known sometimes as Obamacare or the Health Insurance Exchange. And what the designation was for is to give an opportunity for folks that weren't provided healthcare coverage through an employer or through some sort of federal or state-based assistance program, an opportunity to get healthcare coverage and attempt to secure it at a rate that was affordable for them based on their income. As you apply through healthcare.gov or through an agent, what you're looking to achieve is based on the number of people in your household, the total income in your household, a monthly tax credit that gets applied to any insurance plan that's available in the marketplace.
Okay. So the next big question is, because a lot of people have difficulty with having the funds to actually pay for health insurance, because I think that a lot of myths out here that health insurance is so expensive. So people would, prefer to go without it, when now through the Obamacare / affordable health care that they have made this very reasonable and affordable. That's why it's called affordable health care. So tell us, how will we qualify for a tax credit? And remember that a tax credit is different from a tax deduction. A tax credit is dollars, actual money to help you pay for your health insurance. So it doesn't work like a deduction. It's actual dollars, money that will pay for your health insurance.
Certainly. So qualifying for a tax credit involves a few elements. The first thing is going to be getting an understanding of your household. You'll want to determine how many people are actually in your household and how many people actually need coverage. There are going to be some circumstances where maybe some members of the household may be covered. If you have a roommate, for example, that wouldn't be somebody you would include. You would be looking to include your members of your family, would include your spouse or any dependents. Once you have an idea of the number of people that would want coverage in the household, you also have to take in the total income from within the household. And that is compared to the federal poverty limit. You do have to make at least 100% of the federal poverty limit based on the number of people that would need coverage. So for example, the federal poverty limit in 2022 for, let's say, a single person that may own their own business is $12,880. And again, what that's based on is your modified adjusted gross income. So that's going to be your gross income less deductions. If you make somewhere between 100% of the federal poverty limit, so again, that's $12,880, up to 400%, which is around $52,000, depending on where you fall within that range of 100 to 400% of the federal poverty limit for the number of people in your household, that garners an amount that could be afforded to you to pay your insurance on a monthly basis. It's going to have other factors, including geographically, as depending on where you live, healthcare coverage can be wildly different and insurance premiums can be wildly different. For example, it's a lot more expensive to live in the Northeast than it is here in the Southeast. It's going to be based on age, and it's going to be based on gender. And in a lot of cases, some of our folks that are over 50 years old are seeing a lot larger tax credits afforded to them now, as in April, the American Rescue Plan that was passed gave the Affordable Care Act and the Marketplace Exchange a lot more subsidies to folks that were already covered. Plus, it gave an open window for enrollment due to COVID, and it gave people that were receiving unemployment compensation, free health insurance for the rest of the year. So they have really tried to add a lot of value to the healthcare marketplace to entice people and incentivize people to take a look and see what they may qualify for. And when you're looking at plans, something to keep in mind is going to be what can you afford? There's metallic levels associated with plans such as bronze, which will typically be the cheapest plans, but they will cost you more to use your coverage. silver level plans, which are going to be a pretty good mix of how much you're spending and how much your coverage can do for you before you meet a deductible. And then there's gold level plans, which are going to cost a little bit more, but likely are going to have the lowest deductibles and the lowest co-payments. Qualifying also for tax credits means you do have to file your taxes a certain way. Now, this is not based on your business income. This is based on your personal income tax. So they would fall in the same guidelines of filing your taxes by April 17th, I believe is the deadline.
15.
Thank you. So as it falls in line with your personal income taxes, if you are married, you do in most cases have to file your taxes as married filing jointly in order to qualify for an advanced tax credit on a health insurance plan through the federal marketplace. I was trying to think if there's another qualification, but typically that's going to be the biggest factor, is making sure that you do file based on your marital status.
Okay. Now say, and just in case for people, like, because a lot of people that own their business, but they may be married to somebody that is a W-2 employee that carries the insurance for the family. Would they qualify for tax credit even if they don't get insurance through the marketplace? Do they qualify for these tax credits for having insurance?
That is a great question. And in most cases, unfortunately, they don't, because part of the application process is to indicate that you don't have access to healthcare coverage through an employer or a spouse's employer, or through another program which might be offered federally, such as Veterans Assistance or Medicare, or state-based assistance such as Medicaid. Okay. So typically, if you qualify for some other means of having coverage, you can still purchase a plan through the marketplace, but it would be at the unsubsidized cost.
Okay, but I'm just saying, if I say I am a W-2 employee, I work for ABC Trucking, and ABC Trucking actually offers me health insurance, do I qualify? Should I be asking my account when I go to file my taxes, do I qualify for tax credits, or does your insurance have to come directly from the marketplace in order to get these tax credits? Is it
right? So at the point that you become eligible for the health insurance coverage through the trucking company, at that point, that's what makes you ineligible for a tax credit through the marketplace, because you would be able to secure healthcare coverage at what they consider to be an affordable rate if it's through your employer.
Okay.
If they don't provide it, say if you are a part-time employee, a 1099 employee, or you may be a W-2 employee, but they just don't simply provide healthcare coverage because maybe the business is 1 or 2 employees and they're under the mandate for having to provide it. In that case, you certainly could qualify for a tax credit.
Okay. And then if anybody that's listening, please do drop the questions and I'll post them on the screen. Remember that no question is a stupid question. It might be a question that somebody else is too scared to ask, and you actually could be saving a life or helping somebody get insurance because they're too scared to ask the question. Or feel free to ask questions on behalf of other people, so that way the better that you know the truth versus the myths and what's not real out here, the more informed you are, the better judgments you can make going forth, especially concerning your health, because we don't get but one life.
That's right. It's what I like to call creating a space for wisdom. Truly, any question is a fantastic question for me.
Okay, and then the next question is, since this is a tax credit, what happens when I do my taxes?
Okay, so when you go to do your taxes, when you apply for an advanced premium tax credit through the marketplace, it almost feels like it's the step to actually apply for insurance. But what you're attempting to do is gain eligibility for a monthly credit. At the end of the year, you are sent a form. It's called a 1095-A form. When you get that form, you will take that to do your taxes, because it will show the monthly amount of credit that was provided toward the cost of your insurance. Now, as you fill out an application, and this is a really important thing to consider, especially because a lot of business owners try to maintain keeping their taxable income rather low. When you do fill out an application for Obamacare, you are going to add all of the household income together. So if you did have a spouse that, say, was a W-2 employee but didn't have healthcare coverage provided through their employer, your income through your business or whatever your business has paid you, if you do have any dependents in the household, and if they have any income, you would add that in as well. And at the end of the year, you reconcile your tax credits with that 1095A form by what you told the system you thought you were going to make in the year to what you actually did make. So a piece of advice that I do give my clients when they're looking at applying for a tax credit is to overestimate your income just a little bit. Because if you overstate your income and you actually make a little bit less than what's on the application, you technically would have qualified for additional credit throughout the year, and it would be added to your tax return. Conversely, if you understate your income, which would give you a higher tax credit throughout the year, but it turns out you make more than what's indicated on your application, they can ask for some of that credit back at the end of the year. So you do want to be pretty sensitive to what you're indicating your income is going to be for the upcoming year when you apply for healthcare coverage.
Okay, so is it a set dollar amount that they actually give you as the credit, or is it, or the credit's based on your income?
Well, it is a set amount. As you fill out your application, they're going to initially make you eligible for X number of dollars. Now, if your situation does change throughout the year, say if you move, if you have an addition to the family, say if somebody's had a baby, or if you do have additional income, you would update your application, and that can change the amount of credit that you're given every month. But it's supposed to be so that at the end of the year, everything matches with the income that you do file.
Okay.
So it's static, but if your circumstances change and you update it in the marketplace, then your amount of credit can be adjusted accordingly.
Okay. Let's see. Who can be covered under my plan?
Sure. So it can be yourself, your spouse, and any dependents in the household. And the dependent typically is going to be any child that you may have that you're the legal guardian for that's under the age of 26. Once they become age 26, at that point they need to be spun off and have their own coverage, or perhaps they're in college and they're going to be covered under a collegiate plan, or maybe perhaps they are already currently working and they're covered under an employer-based plan. But again, typically it's going to be yourself, your spouse, and any eligible dependents.
Okay. So in the event that, say, I've got an elderly parent that lives with me, but they're not old enough to get Medicare. Mm-hmm. So they're in that gap period. Should they get their own coverage, or would they come under my coverage plan if they are my dependent?
If they are your dependent, they can be on your plan.
Okay.
If they are not, and you do file separate taxes, they would be able to qualify potentially on their own with their income. We would indicate that you're in the household, but we would only list you as a household member and not necessarily as an individual desiring coverage. So it would be two separate policies.
Okay. And then how can I apply for health insurance through the health insurance marketplace?
Sure. Anybody can do this. You can go directly to the source. It's www.healthcare.gov. It is the main system that has support from agents just like myself. You can go there and just do an estimate on tax credits. It's an application process that generally takes about 25 to 35 minutes. If you have a larger family or a larger number of people that require coverage, it can take a little bit longer. Or what you can do is contact an agent such as myself. I do have a tool that I send to my clients. It's a tool some people may be familiar with called Health Sherpa that streamlines the application process. Generally takes about a moment or two just to answer some simple questions and input the number of people needing coverage, age, gender, zip code, and your income to see what sort of a credit you can qualify for. I'd be happy to run an example if you guys want to see one. And you can directly enroll from there. And again, what it's going to take into account and the information you're going to want to have is everybody in the household's names, dates of birth, social security numbers. If you do have other household members that may need to be covered, there's certain circumstances where you may live at separate addresses. And that is one thing to point out. Sometimes going directly to the source can be helpful, but having an agent to work through some scenarios that not everybody fits into a perfect box it can be an advantage above and beyond just having somebody explain how coverage works. as there is a little bit of nuance to tax credits, as this involves the IRS and things of that nature. But again, if you are so inclined, anybody can check this out. And I encourage everybody to check this out because there's also a fantastic search option to ask questions. And again, it's www.healthcare.gov, or contact a local health insurance agent like myself.
Okay. And since your link to you directly was a little bit long, I put it in the comments. So it's the first comment in the comment section. So that way people can just click on it and get you directly. And they didn't have to go through all that. And then if people are anything like me, this would be mind-boggling. So I couldn't sit there and read all that stuff, and I don't want to read it. So I definitely would want to just call somebody and let somebody just tell me and explain it to me. And then even if they aren't telling me exactly which plan to pick, I can make a more informed decision based on what they're verbally giving me as information. And then we've got a comment here from my dear cousin Erica. She's tuning in on IG. And she said, great coverage. Just asked the question the other day and didn't get the answer. So thanks for this platform tonight. So we are, making a difference for, even if it's just one person. And don't forget to, this is a great opportunity for you to ask questions. Like I said, but the link to Nathan directly is in the comment section. We'll move on to the next question. What would you tell someone that has looked at this in the past and decided it wasn't for them? And I know that there's like a lot of myths out here about you don't want Obamacare, you don't want affordable health care, you don't, and they're going to put, a needle in you and sew you up. They're not going to get, like you're not going to see real doctors. So please, elaborate on that.
Sure. So I have heard some of these things in the past, but truly and honestly, it's health insurance coverage that you could purchase from the health insurance company directly. You can go to Blue Cross Blue Shield of North Carolina or Blue Cross Blue Shield of South Carolina and purchase a plan that's not on the exchange. And the benefit structure is literally going to be almost virtually the same. It's only a matter of being able to qualify based on your household based on the number of people in the household and what your total income is to qualify for a subsidy to help pay for this health insurance coverage, because premiums, quite frankly, are out of control. And for a long time, between 2013, 2014, and 2015, one of the larger criticisms of the Obamacare exchange was that premiums tended to increase and benefits didn't necessarily change. Although it was fantastic because there wasn't a consideration for pre-existing conditions, nor is there now. Nothing is excluded. That's why they have the open enrollment season, because anybody is allowed to apply. It doesn't matter if you fell and broke your leg. If you can make it to January 1st and apply for coverage, you're going to have health insurance. I mean, it's fantastic. That's just one of the major criticisms for health insurance through the 70s, 80s, and 90s is that the minute that you had a problem with you, it was going to be excluded for the rest of your life. And that's just truly not the case anymore. And another criticism, again, with the premiums that were rising, there wasn't that much of a commensurate rate in which tax credits were increasing. Well, that changed a lot in April. And I'll give you a fantastic example. I had a woman that when I met her, she had done her health insurance coverage through another agent for 2021. And at the time, her insurance was going to cost her $392 a month. In April, when they passed the American Rescue Plan Act and they expanded the tax credit subsidies, her rate went from $392 a month down to $96.
Wow.
It's tremendous. And again, it's all going to be based on that sliding scale from where your total household income is in relation to the federal poverty limit. And the closer you get, or the lower income spectrum that you may be on, the more affordable the coverage tends to be. But that's by design. It's supposed to be at the same rate at which you can afford to use the coverage. So should your income match the features of the policy, such as co-payments and deductibles being fairly low if you're closer to, for example, only making $13,000 a year. I can expect somebody making $13,000 a year to not have the same ability to pay for healthcare coverage as somebody making $51,000 a year. So if you looked at it in the past and you thought that you didn't qualify for a credit or there just wasn't not that much there for you, double check again for at least 2022, and hopefully they'll expand it later. They are throwing a lot more money at people to help you pay for your healthcare coverage. If it only takes 5 minutes to see if you're still right, it's still worth looking.
Okay, so I do want to go back and recap on what you were saying. That lady's payments went from what, $392 to $96. So instead of waiting to take your tax credit at the end of the year, help me if I'm wrong, you can actually take it throughout the year and apply it to your premium. So then your monthly out-of-pocket expense for your premiums on a monthly basis are lower.
Yeah, that's actually the way that it does work. It's an advanced monthly tax credit. So they do give it to you on a monthly basis. You have the ability to defer that until the end of the year. However, most people do go ahead and take it for the monthly basis. If you'd like, I can do a screen share just to kind of show you loosely how this would work. I can do a very quick example.
Okay. Yeah, sure.
Okay. Let's see here.
So I'm going to talk a little bit while you're getting that up.
Sure.
Okay. I think that, are you ready for me to add it in now? Let me know when you're on that screen. I can actually share it.
Okay, go ahead. Let me know when you're ready. Okay.
Okay.
So give me your zip code down there in Lancaster.
29720.
Okay. So I'm going to make up a hypothetical household, a family of 4. Okay. Let's have a 35-year-old female, and we'll say she's a parent of somebody under 19. I'm going to add in a spouse, and we'll say he's 40. I'll add in 2 children. Age 10, daughter, and I'll add in a son, age 5. Now I have 4 people in this household in the 29720 zip code, and I'm going to say that this household has an income of $90,000.
Okay.
Okay. So you see
now,
here,
I do want to ask you one question. So does it matter when you say household? So because it's going off of, is it going off the number of people or is it going off of the actual income?
both, and it's going off of the number of people that need the coverage.
Okay.
Now, the other thing that this system is designed to do is if there is another lower cost option for anyone in the household to qualify for coverage, it will double check that. So for example, at $90,000 for this household of 4 in your home zip code, they may qualify for $911 per month toward the cost of any plan that's available.
Okay. So then if they decide not to do that, then they could get almost $12,000 back.
Correct.
At the end of the year, if they just want to bank it and not actually use it towards the premiums?
That's correct.
Oh, wow.
That is correct.
You get paid $12,000 at the end of the year for having health insurance.
You could. It's absolutely an option. At the end of the application process, you are given a sliding scale to say how much of your monthly credit you want applied to your rate. If you defer it, it accrues, and at the end of the year, you will reconcile how much you actually did make with this number here that we would put in on the application. And depending on if you were above that figure, it would be a little bit less that you would receive at the end of the year. But if you don't make that much, then you may receive a larger tax credit because you would have qualified for that throughout the year, having at the end of the year realized that when you do your taxes.
Oh, wow. That's awesome.
Yeah. Now I'll show you another example. So again, this is going to attempt to see if there's any other option. And in some cases, it will attempt to qualify for members of the household that may be eligible for state-based assistance. But it's all going to be, again, on where your income falls in with that federal poverty limit and how many people are in your household. So if I had 4 people and say $35,000, I may see that what it would tell me is that the father and the mother are eligible for health insurance coverage. They're still eligible for $863 to be afforded toward any plan that they choose in the marketplace. but the kids may be eligible in this state from South Carolina for South Carolina Healthy Connections.
Okay. Yeah, and so Erica just made another good comment that says, there's so much help out here actually to make it affordable, but people are just not aware. And
they're not. My industry has a branding problem, guys. I don't know any other way to think about it. It keeps me up at night. I wish there was an easy got milk kind of way to get people to go, health insurance, but there's just not yet. We're not there yet. We're getting there, but I promise you, you're going to see a lot more advertising on it. I see it all over social media now for healthcare.gov. And other, of course, insurance companies are really trying to purport that you can even qualify for plans after your subsidy is applied that may be under $20 a month. I'll give you an example. I'll scroll down here and take a look at it. So let's just say I've got my household. I'm going to put it back at 90,000.
Right.
Okay. And again, we have that roughly $911 a month in credit. So here's the plans. This is the marketplace, guys, right here. And in South Carolina, we have 3 companies that are participating in the Lancaster and York County area. They're going to be Blue Cross Blue Shield of South Carolina, Ambetter, and Molina Healthcare. I would tell you, Blue Cross Blue Shield is always steady Eddie. It's a very reliable carrier that most people can recognize, either having had in some form or fashion, or at least the Blue Cross and the Blue Shield. Ambetter, fairly new company that's come into the marketplace in the last couple of years. Initially, in 2019, they didn't have a pretty robust network, but now they've been around the block and they've gotten a little bit better. I think they're really fantastic in the more metropolitan areas, like in Columbia. But as I'm scrolling through here, what we're actually looking at are plans that are available on the marketplace. So let's say, for example, this plan that I have in my screen here from Blue Cross Blue Shield, the plan actually costs on a monthly basis $1,185. But based on the tax credit that you may receive, the premium that you pay on a monthly basis, if you decide not to defer it, would be $274 a month. Now, you will want to browse a few things. You can research medications, you can research physicians, and you can see the benefits that the plan offers, and they're all going to be laid out the same way. And this is the resource that I provide for my clients, is to help research those medications, research those doctors, and review the benefits that are available. And also, having done this for a couple of years here in the state, I have a couple of ideas on some of the plans that stand out to be the best bang for your buck. And that's really what you're looking for with healthcare coverage. When I look at plans, I don't like to see things like this, where anytime I want to see a doctor or a specialist or get medication, I have to satisfy a pretty sizable deductible first. Usually I want to see that there's going to be some sort of coverage before I meet a deductible. So an example like here would be maybe this Ambetter plan. Has a reasonable deductible for the year for an individual. And I also can see a doctor for a copayment, a specialist for a copayment, and I have coverage for generic drugs, all before I meet a deductible. There's going to be other plans that even include vision and dental for adults. So you don't have to go and purchase a separate vision and dental plan. It's pretty fantastic stuff. And the other thing you can do with this quote tool is maybe be in contact with your CPA to discuss what your taxable income is going to be for the year and try out different figures. Maybe if you're able to have an income of $75,000 that's taxable, you could qualify this household for almost $1,100 in tax credits.
Okay, and Erica's on here saying that she's glad she joined because her husband actually wants to keep working. And a lot of people get jobs or keep working because they're worried about how much it will cost for health care. And now with this, people can actually, leave their 9 to 5 and go chase their dreams, basically, because your first year out, you're really not going to probably have that much income, qualify for a good subsidy, have a low premium, apply your subsidy to your premiums, and pay little to no insurance out of pocket, because before Obamacare, you just didn't have that option if you wanted to go chase your dreams. And since we are a business academy at Bossed Up Academy, we encourage entrepreneurship. And this is a great way. I mean, because if you can't afford $96 as an individual, then I mean that's $25 a week. That's a trip to McDonald's, basically, and you could have health insurance.
Absolutely. Absolutely. You know, and it's part of a business continuity plan. The business can't run if you can't run. It's that simple.
Right. So this is a great opportunity if somebody, because I mean, I remember when I first quit my job as a teacher, there was this program called Cobra, and that was basically your only option unless you paid, almost $1,000 a month by yourself. I mean, for your health insurance for one person,
Right.
This has been many moons ago, but now I think that with the Obamacare, the Affordable Health Care Act, and now you telling me on top of the Affordable Health Care Act, now you got the American Rescue Plan that is going to throw even more dollars out at you. So, I mean, it's a no-brainer at this point.
Absolutely worth your time to take a look. Nobody should have to sell you on it. If it makes sense and you qualify for it, it's a program that's designed to help you.
Okay, so a lot of people I know that, people make New Year's resolutions at the beginning of the year. So what if I quit my job to go start my business after the enrollment period is up, and I decide, I'm going to start on my business in January and I'm going to actually open my doors in March. Sure. How do I get health insurance, or do I have to pray until open enrollment that nothing happens to me?
It's a fantastic question. And the good news is you can qualify for a special enrollment period when you lose qualifying coverage. So if you were covered under a group plan from your employer, at the date that you terminate your employment, typically that's going to be the last date that you'll have coverage. As of that date, it opens up what they call a special enrollment period. So from that date forward, you have 60 days that you can put in an application for an advanced tax credit. Now, I would typically recommend, if you decide to leave your job, if you're going to make that decision, which should involve a lot of other things, including conversations with those you love, as I did, coverage will begin on the first of the month. So you will want to likely leave the position closer to the end of the month so that when you've done your application, so for example, if you had the last day of work be February 28th, the special enrollment period is available and your coverage can start March 1st. If you were to quit on February 10th, the soonest your coverage would start would be March 1st, leaving you with a period of time where you would have to either A, go uninsured, or B, consider a 30-day short-term medical plan.
Okay, that's very good information. So if you're gonna quit your job or get fired,
you're planning an exit. If you've got an exit strategy, make it for the end of the month if you can.
Okay, that's very good information.
Find your happy place,
Yeah. Okay, well, I think that I pretty much answered all the questions. And is there anything else that we did not cover that you just think that, just as a closer, that people need to know that maybe even a lot of agents aren't telling people? Because I know that everybody's level of expertise is not the same when it comes to being knowledgeable about the healthcare system. And I know you were talking about the lady that was with another agent, but then when she switched over to you, you were able to give her more accommodations. So our agents are not created equally.
Right.
So as a closer, what would you say as to, what you're finding, that just from you talking to different people, of what people are not educating other people on?
Well, I would say if you're looking for an agent, one of the first things you're going to want to do is make sure they listen to you. Because I hear from people that have different varying healthcare needs. I have some people that are fairly healthy, fairly young, and maybe all they need is catastrophic coverage. I have other people that are managing chronic conditions, and any sort of a gyration in the plan that they have could wildly spin into a complicated nightmare of bills and doctor appointments. So make sure anybody that you're working with is listening to what you are bringing to the table and thoroughly having a conversation about the members of the household that need coverage and the income. Again, that's the taxable income in the household to guide you toward qualifying for a tax credit. The other thing I would look for is maybe somebody that stays up to date on current events. One of the things that I'm monitoring now is we had the passage of the infrastructure bill, or at least we hope to have it. But part of what could also benefit the marketplace would be the passage of the Build Back Better Act. I'm really looking at that. There's hopefully going to be a little bit of an expansion of the tax credits. Right now, they're only the current level through the end of 2022. Hopefully, we're going to see them go through the end of 2025. And then, as you know, it tends to be a continuing resolution. So that's going to be something that could potentially impact my clients this time next year, depending on whether those tax credits get extended. We may have to look at different plans, just depending on the amount that they may qualify for in the following year. But it's also good to have somebody that you can call and talk to that's aware of your current situation, that you can call and say, hey, listen, I'm going to be moving to Georgia. I don't know, what plans are going to be available there. It's going to be a life change involving having to put in an application and garner coverage for your new state. I would absolutely recommend, if at any point you get stuck in an application, there's another feature where you can, if you do it yourself, just know you can access what they call help on demand, and that would put you in contact with any agent within 15 minutes. Or if you'd like, you're also welcome to reach out to me via text, via email, via my quoting tool, and just submit something to me. I'll be happy to take a look at it. Throughout the year too, I typically send little reminders to my clients to make sure they keep their info updated. I don't like to just be available one point during the year and then you don't hear from me, and then 10 months later I kind of creep up and I'm like, hey, it's open enrollment. So I do send out typically a 6-month reminder to just touch base with you, see how you're doing, catch up with you, make sure you're on track. Are you still on pace for your goals? Has anything changed? And that's maybe something I think you can see some value in as someone that's just looking out for you.
Okay, I do have one closing question, and then we're going to hop off of here because it's kind of getting late.
Okay.
The question I have is, there are some people that are out of work. They've exhausted all of their unemployment benefits. And I can't pay a $96 because I have zero income. Will I qualify for something on the marketplace?
Depending on the situation, if there is at least a way that you can purport that you will make the minimum requirement to garner a tax credit, again, if you make at least what the federal poverty limit's going to be, by the end of the year, when you go to file your taxes, you can complete an application, because you're basically putting out the best faith guesstimate about what your next year is going to look like. And not everybody's got a crystal ball. If you're one of those people that's sitting here in January thinking that you may leave your job in January, you may not have exactly the income that you're thinking that you have at the end of 2021. But as long as you've made a really good effort to try to at least make the amount of money that it would take to qualify for any tax credit, go ahead and apply and put in that it's self-employment income. I do have some people that are kind of in that situation where they were able to get a $0 plan, because another thing the Affordable Care Act did for folks was give people a $0 silver plan if they received unemployment for a week in 2021. Well, unfortunately, that's going away, but not necessarily the actual unemployment itself. So I have some clients that my intention is to complete an application, indicate that they'll make at least what the amount of money is they think they need to survive, and then maybe set a quarterly follow-up to say, hey, has your circumstances changed? Are we going to be updating it? Are you now in business for yourself? Have you gone back to work? Are you going to be afforded coverage through a new job? Because at the point, and some people only use the healthcare exchange for a short period of time. You may only use the health insurance marketplace if you're between jobs and you lose healthcare from one job and you're waiting for it to start for another. So you also, to have somebody that can say, hey, if you have more income, we're going to want to update your application so everything goes commensurately. Or we know you're going to have coverage starting in a month or two. I'll call you to make sure we stop your plan so that you had at least the coverage that you were afforded and you qualified for up until you got new insurance.
Okay. One last thing. What all states are you able? I know that the marketplace, if they go on the website, the generic website, anybody in the United States can do it. But what states are you actually licensed to write coverage in?
So I'm licensed for North Carolina and I'm licensed for South Carolina. And I'm part of two agent groups that are essentially at least 150 other agents I have contact with that are licensed across the entire U.S. So if anybody does want to speak with a licensed agent outside of North Carolina and South Carolina, I'd be happy to put you in contact with somebody that can answer questions for your situation specifically.
Oh, awesome. Thank you so much. This was so informative. And we're going to leave this up and people can watch the replays and be sure to like and share this video. Tag somebody that you know that might be having medical challenges and they do not have health insurance. And this is a great opportunity for them to get insurance that can not only cover their doctor's visits, but some of their prescription medicines as well. And remember, you don't have to be a business owner to participate in the program. It is income based. So please do like and share this video. You could actually, instead of saving someone's business, you could be saving their actual life. That's because they will have benefits now. So thank you.
No exclusions for pre-existing conditions. So it is game on.
Okay, awesome. Let me make sure I got one more comment. Oh, and then they said, thanks to Boss Academy. Amazing information. Erica, thank you for all the information you have been giving out since COVID and for free. Yeah, we've been giving a lot of information. And Erica, I really, truly, am grateful for your support. You often, tune in, engage in the videos. You and my only one, Graham, both are very supportive and helping to move the conversations forward, giving us feedback that we know that we're on the right track, doing the right things, because sometimes when you don't see the fruits of your labor, sometimes you kind of get discouraged. But Erica, you are one of those people that help, that lets me know that, hey, this is awesome information. And also one and only Graham, I appreciate. And there's several others, but since the two of your names are up on the screen tonight, I do want to give both of you a special thank you. And thank you again, Nathan, for taking time out of your night, because I know that you're really busy, this busy season for you. But I wanted to get this information out before the open enrollment period was up so we could touch as many people as possible to help with this, to let them know that there is help out here and to dispel some of the myths that go and involve the affordable health care. So I'm glad we were able to do that tonight. And Erica, I am so grateful for the response. Have a great night.
Thank you so much.